Hey everyone, welcome to my channel. In this video we talk about what is the fastest way to treat COVID symptoms, including the new variants, vaccine distribution, and travel restrictions, and don't forget to subscribe and like and turn on the notification button. It's true, coronavirus and the flu can feel very similar. Many people who contract either virus can recuperate from the comfort of their own home. 9 ways to recover from COVID-19 and flu at home. 1. Hydrate your body. When people are sick, they often have low energy and appetite levels, which can lead to less liquid consumption and dehydration. Having symptoms of fever, diarrhea, and/or vomiting can also cause dehydration. It's important to drink plenty of water so your body has what it needs to fight off an illness like COVID-19 or the flu. No need to overdo the water intake. Usually the recommended amount depends on body size, but it's generally 8 ounces glasses of water in one day. 2. Eat chicken noodle soup. Yes, grandmother was right. Chicken noodle soups relieves congestion since it's hot and steamy. This can help the nose start to run, which reduces sinus pressure. The steam also helps with dryness and irritation in your nose. Meanwhile, the chicken provides energy in an easy-to-digest protein, and the broth helps with rehydration. Some other feel-better fast foods include leafy green vegetables, crackers, eggs, bananas, apples, and any lean proteins. Skip the dairy. It's hard to digest and can aggravate nausea. 3. Try adding some honey. Honey is an antioxidant that can make you feel better. It can soothe a sore throat and relieve a cough. You can try a teaspoon or 2 plain or add it to your tea. It's good for kids too. But remember, honey is only for children after their first birthday. Forget plenty of shut-eye. Rest is essential to feeling better. Our immune system only weakens if we don't get proper rest. Aim to get more sleep than what's recommended. For adults, that means going above and beyond 7 to 9 hours. 5. Stop exercising. When you are feeling rough, it's best to skip exercise, mainly long bouts of exercise or intense workouts. You should especially listen to this advice if you notice symptoms of fever, muscle/joint pain, vomiting, headache, and/or diarrhea with your virus. These symptoms are a sign your body is busy fighting off the infection and needs all your energy to do its job. 6. Gargle with salt water. Gargling with salt water is a popular remedy to help sore throats and common colds. The salt helps draw liquids to the surface, along with any viruses or bacteria in the throat. You can use warm or cool water for this, but warm water often feels better. Just mix about 1/2 teaspoon of salt in a glass of water to gargle a couple times per day. 7. Take over-the-counter medications. If you have a fever or body aches, you can take over-the-counter pain medications like acetaminophen or ibuprofen. If you are diagnosed with the flu, you can talk to your doctor about a prescription for an antiviral like Tamiflu. Antivirals are most effective if started within the first 48 hours of symptoms. If used accurately, they can shorten the duration of illness by about 24 hours and decrease the risk of complications, especially in high-risk populations. 8. Sit in a steamy bathroom. Adults and children alike could benefit from sitting in a room that's full of moist, warm steam that collects in the room from a running, hot shower. This can help loosen nose secretions so it doesn't build up, causing breathing or cough difficulty. Using a cool mist humidifier serves the same purpose as does putting your head above a steaming bowl of water. 9. Take a lukewarm bath. Taking a lukewarm bath means finding a temperature that is warm but not hot. This can help boost circulation and help the body regulate temperature back to normal if you have a fever. Similarly, if you have a fever, it's a good idea to take off clothing layers and go with shorts and a t-shirt or something very basic to allow your body to cool off. For the same reason, try to avoid bundling up under lots of covers while in bed. How long does it take to recover from COVID-19 and the flu? While you now have some tools to get better, it's going to take your body some time to kick the illness. The average recovery time for those who have mild or normal cases of COVID-19 or flu is between 1 and 2 weeks. If you have COVID-19, the CDC recommends isolation from others. Also, make sure you are fever-free for 24 hours without the use of fever-reducing medication. Here are some tips to help reduce the spread of viruses within your own household. Wear a mask. Yes, even in your own home. Don't share. Keep all dishes, towels, and bedding to yourself. Isolate. Try your best to stay in a different room and use a separate bathroom if possible. Keep cleaning. Wash your hands often or use hand sanitizer and disinfect frequently touched surfaces often. Monitor your health. If you start feeling worse, talk to your doctor. Emergency warning signs for both COVID-19 and the flu include difficulty breathing or shortness of breath, pain or pressure in the chest, new confusion, dizziness, bluish lips or face, and difficulty arousing. If you have a medical emergency, contact 911 immediately. As the COVID-19 pandemic evolved, we heard about variants of the virus that were different from the original one that started the pandemic. Here are the basics on variants. What is a variant? When viruses spread, they make copies of themselves. As they do, they often mutate or change a little bit. A copy that is different from the original virus is called a variant. Sometimes variants don't seem that different from the original virus. Others may have clear differences. COVID-19, travel restrictions, and environmental consequences. During the COVID-19 pandemic, global travel restrictions were imposed, which led to environmental consequences. To understand this issue, DeWeese et al. 2022 observed greenhouse gas emissions in pre-, early, and post-pandemic situations for the year 2020. For this purpose, data were collected from a travel survey in Canada. The empirical findings proved that COVID-19 restricted travel, reducing greenhouse gas emissions. A strain may be considered a variant of interest or VOI if vaccines or previous cases of COVID are somewhat less protective against it. It's predicted to spread faster and cause worse symptoms. Treatments and tests work less well on it. How do variants happen? Coronaviruses have all their genetic material in something called RNA, ribonucleic acid. RNA has some similarities to DNA, but they aren't the same. When viruses infect you, they attach to your cells, get inside them, and make copies of their RNA, which helps them spread. If there's a copying mistake, the RNA gets changed. Scientists call those changes mutations. These changes happen randomly and by accident. It's a normal part of what happens to viruses as they multiply and spread. What is the Omicron variant? The Omicron variant, B.1.1.529, was first detected on November 11, 2021, in Botswana. Experts in South Africa first reported the Omicron variant to the World Health Organization, WHO, on November 24, 2021. They discovered the variant after COVID-19 infections suddenly began to go up. Omicron has gone through several mutations. Some COVID variants that developed earlier in the pandemic include Alpha B.1.1.7. In late 2020, experts noted gene mutations in COVID-19 cases seen in people in southeastern England. This variant has since been reported in other countries, including the U.S. Scientists estimate that these mutations could make the virus more transmissible. Beta B.1.351. This variant was first found in other countries, including South Africa and Nigeria. The beta variant appears to spread more easily than the original virus but doesn't seem to cause worse illness. Gamma P.1. In January 2021, experts spotted this COVID-19 variant in people from Brazil who traveled to Japan. By the end of that month, it was showing up in the U.S. The Gamma variant appears to be more contagious than earlier strains of the virus, and it may be able to infect people who've already had COVID-19. A report from Brazil confirms that a 29-year-old woman came down with this variant after an earlier coronavirus infection a few months before. Delta B.1.617.2. The highly transmissible COVID-19 Delta variant, also known as B1617.2, was found in India in October 2020. It was the dominant strain in the US and several other countries during the fall of 2021, but by March of 2022 accounted for 0 cases in the US, having been overtaken by the even more contagious Omicron variant. Mu B.1.621. Experts first spotted this COVID-19 variant, pronounced Mayu, in Colombia in January 2021. Since then, countries in South America and Europe have reported outbreaks of Mu. In the U.S., the CDC says Mu reached a peak in June 2021, when it made up less than 5% of variants going around the country. R.1. Scientists first detected R.1 in a number of countries, including Japan. There was an outbreak at a Kentucky nursing home in March 2021 when an unvaccinated healthcare worker passed it to about 45 other staff and residents. That's it for today's video. If you enjoyed this content, don't forget to like and subscribe to our channel for more fascinating insights. Be sure to hit the bell icon to stay updated with our latest videos. We also encourage you to leave a comment below sharing your thoughts and suggestions for future topics. Thanks for watching.